And welcome everyone to Health Coach TV. It's Dr. Shaunna here, and I am so excited for tonight. We have a very special guest that you are definitely going to want to hear. And I just want to acknowledge Dr. Selvi Vasudevan. Thank you for joining us.
Thank you, Dr. Shaunna, for having me.
My pleasure. So I'm going to give you a proper introduction just in a moment, but I wanted to just kind of fill people in with what's going on here. So as many of you know, I've been a medical doctor for over 25 years, and then I also was a health coach as well. And I really knew the power of healthy habits. And so it has been my mission to kind of celebrate some of these health coaches who are doing amazing work. Because what I know as a doctor and as a health coach, and just, I mean, heck, look around, you'll see it yourself, that there are so many people out there with obesity, diabetes, cancer, heart disease, and they are struggling. But what I also know from my work as a health coach is that there are these amazing people, this amazing group of health coaches who have gifts and talents and areas of expertise, not in everything, but in a specific niche. And it just might be what the doctor ordered. So before we get started, I want to let you know that although I am a medical doctor, and our special guest today is also a medical doctor and a health coach. So although we are doctors, we're not your doctor. So you'll always want to consult with your own healthcare provider about what is right for you. That's really important that we say that right up front. But we're going to dive in, and especially the topic of Crohn's disease. And so if you know someone who has Crohn's or colitis, IBD, and let them know that we're going live now. We're going to be answering questions, and we're going to be diving into some of these things. So let me, without further ado, dive in and give you a proper introduction, Selvi. So Dr. Selvi Vasudevan has been a medical doctor. She's graduated from Rikers Medical School in 2005. She also trained at Stony Brook University in pediatrics. And then observing her patients, she noted the important role of stress and nutrition, not only for her patients' health, but even her own. And then she subsequently studied at the Institute for Integrative Nutrition, IIN, to further increase her knowledge and then really figure out how to integrate this important work in nutrition and lifestyle medicine into her own practice. So her particular area of expertise is Crohn's, and she comes by that naturally. She has had Crohn's disease herself for 23 years. So although she is a doctor, she's also been a patient, and we're going to find out about that. So she likes to help her clients now find those nutritional and lifestyle medicine ways to help soothe and even prevent Crohn's flares with the scientific data to explain why that is. So it's really important. She is now a international speaker and writer on the subject of Crohn's disease. And without further ado, welcome, Selvi.
Thank you, Dr. Shaunna.
Awesome. So tell us, what is it that you do now? Like, I know you've had a varied background. We're going to dive into that a little bit, but what do you do now?
Well, specifically what I do now is I help women with Crohn's disease to heal their guts naturally so they can enjoy life again. Because, most of us have had a lot of our life taken away from us by this disease. And what's the point of life if you can't live it and enjoy it?
Yeah, for sure. Yeah. And so it's such a perfect area for you to focus on, obviously. You didn't choose it necessarily, but it is good. And I'm so glad that there are people like you that are willing to do that work. So take us back a little bit. Why did you even want to become a doctor in the first place?
I guess you could call it a calling. I remember almost as long as I can remember, like from the age of 5 years old, wanting to be a doctor. I believe that I am just an innate healer. I was always that person who could never stand to see someone in pain, someone suffering. My heart would just always go out to them. And so I would just want to relieve that in any way possible. And so, I followed my path to medicine. And once I got there, I kind of realized that there wasn't as much of that healing and nurturing as I would have liked. And that was one of my frustrations when I was practicing.
Yeah, yeah. Well, take us back to, and for anyone joining us, we're speaking with Dr. Selvi Vasudevan about Crohn's disease and some things that you can do. And type in the comments here, either if you are a health coach, let us know if you're a health coach. We want to acknowledge you. And then also if you have Crohn's or IBD and you want to just say a shout out and just acknowledge that. And if you have questions for Dr. Selvi while we're going, I'll try and do my best to keep an eye out there. I just want to do a shout out to Christina from Naples, Florida. Hi, Christina, good to see you here. So, tell us, take us back, Selvi, to like, when did you find out you had Crohn's and what was that like?
Well, it certainly changed my life, as anyone who has been diagnosed with IBD knows. I always say it was those 7 words in the gastroenterologist's office. Selvi, I'm afraid you have Crohn's disease, that went on to change my life. Specifically though, I was in college and I was just kind of going along with life, focused on getting to medical school and pushing myself through. And I started to have diarrhea that just wouldn't stop. And couldn't figure out why. And I'd always sort of had a quote unquote sensitive stomach as a child. And so, I thought maybe it was a stomach virus, but it just wouldn't stop. And so further investigation showed that I had high inflammatory markers at the time. And then they wound up doing a subsequent colonoscopy, which showed that I had Crohn's. And prior to that, I had a barium enema, a barium swallow study, which showed inflammation in my terminal ileum, which prompted the colonoscopy, which prompted the diagnosis.
Yeah.
Yeah. And I wound up actually taking a semester off because it was just too much for me to process at the time.
Yeah, and I think a lot of people with Crohn's disease who've been through that, I know I have friends with Crohn's and other colleagues with Crohn's disease. And I think a lot, and then as a radiologist, I was one of those ones that was doing some of those barium tests and ultrasounds and CT scans and things. And so I think a lot of people can relate to that journey. And unless you actually live it, and you've lived it more than I've lived it, unless you actually live it, you don't really know sort of the impact. And it's like you're in such a powerful position because you know both sides of it. So you're a medical doctor and you have Crohn's. What makes you decide to also become a health coach? Because I did that crazy idea. We're a rare breed that is a medical doctor and then becomes a health coach. I know, again, unless you're living it, it's hard to imagine why that is. But what had you decide to become a health coach as well?
For me, I found that I only started really healing on a deep level once I started embracing the power of food, of nutrition, of other things other than just the Western medications that my gastroenterologists were treating me with. That was good, but it was never enough. And it wasn't until I went beyond that and sort of, looked for the other alternatives and found all of the things that I could do myself, by myself, for myself, that I was able to get into a deeper level of healing. And so it made me want to pursue more of that why, the how, and to, study that nutrition and all of those things in a more formal way. Of course, being doctors, right? I think the formal education sort of appeals to us. So
Yeah.
I wanted that piece of the puzzle so that I could really understand the foundation of it and why and how, and translate that to other people in a way that made more sense.
Yeah. Awesome. Well, what some of our viewers may not know is that you have an amazing, inspiring success story. So I'm not going to bring people out here who haven't got a track record. This is master health coach here. So you've had Crohn's for 23 years and then, but more importantly, you've been in remission for years and you've got this amazing, inspiring success story. So let's tell us about your success story, and then we're going to dive a little bit deeper into some of the specifics for it. So definitely, if you're listening in, like grab a pen. After we finish this general bit, we're going to dive into some tips that you can take home with today. So tell us about your success story. I think that's a really important that people know there is hope at the end of this rainbow here. So tell us what's your story.
Sure. And I feel like it's kind of almost important to start with the sort of the muck, so to speak. It was really rough and it was really intense for several years for me. My last semester of college actually was memorable because that was my first major surgery. I went from about to graduate in engineering to winding up in the hospital, needing emergency surgery, and winding up with an ostomy that I had for a year. Thankfully, it was able to be reversed, but that led to a cascade of, further surgeries and further medications, and things weren't working. And finally, I was on just obscene doses of medication, like unsafe doses, but there was really no other alternative.
Mhm.
And I got to a point where I had lost a lot. I had lost time, I had lost purpose, I had lost career at one point. I had lost my will to live because I didn't see what I had to live for. And finally, I felt like I had nothing else to lose. And at that point, I hit a wall and I realized that I had to do something, that I could not go on this way anymore, because I wanted to live. I was always that vibrant, happy go lucky, fun loving girl, and I lost my spark, and I knew that I had to get it back. And so it started with baby steps. It started with, initially just gluten free. And then it was, more research into what about this technique? What about that technique? And some things worked and some things didn't work so well. And it was time and trial and error and getting to know my own body and what was going to work best for it. And the more I tried and the more I learned, the more confidence that I gained. And the more I was willing to experiment, and the better I became. And the medication started lowering, and the amounts of food, or the types of foods actually, that I could eat was starting to now expand. And suddenly I was stronger. And suddenly I was able to put myself out there more. And I was able to start traveling. Like, one of my dreams was to go to India, and I hadn't been able to go in 12 years. That's where my extended family is. And I was able to go back, and I've been able to go back alone now. And it's just been amazing. And, if I was to talk to that girl that I was, 15 years ago, and tell her that one fine day this is where I would be, she would not have believed me. Like,
Yeah.
no way would she have believed that it was even possible. But it is possible with those baby steps. And, when someone can kind of guide you, which is what I had always longed for, why doesn't anyone get it? Why doesn't anyone know how this feels? Like, why isn't there someone who could show me something? I feel like it makes a huge, huge difference. And so I feel very fortunate to be in the position that I'm in right now.
Well, and I just want to thank you for taking the time out tonight to be with us here, and to share some of the tips that are going to be coming. And even your story already has given people hope, I am sure. And, if you're resonating with any of this, feel free to pop that in the comments as well. Or if you have questions, I'll try and catch those as they come up. So you have had Crohn's for 23 years, been in remission for like 9 years, like amazing. You basically cracked the code on Crohn's. It wasn't easy. It was through a lot of painful trial and error, as we've heard. There was a lot of, it didn't just happen like that. But you've learned something. So grab a pen, people. Here, we're about to get into it. Before we go into the specifics and that, I want you to take a moment, though. We did a disclaimer at the beginning, and I also want you to take a moment and talk to people about, what does bio-individual mean? I know if there's IIN health coaches, they know what that word means. But tell our viewers here, what does bio-individual mean before we get into these specific tips?
It's actually what I feel is an extremely critical concept. It's the concept that there is no one size fits all. So one person's food can be literally another person's poison. So what works well for me may not work so well for you, and vice versa. And so that's some of the places where people get tripped up. Because you're kind of trying to look at this one size fits all, or this one label diet, and there's no one catch all. It's just impossible, because as different as we are as human beings, no two people are exactly the same, is the same way that no two food habits may be exactly the same. So it's very important.
Yeah. And, and I remember experiencing this. I've spoken a lot and done videos about superfoods, and talk about how broccoli is a great superfood. But for years, I was sick with broccoli. So it might be good, but not good for me, at least in that 20 years when it wasn't. And so I think it's really important that people do that. And it can be, it's not always obvious to figure out what foods are making you healthy and what foods are making you sick. It was not obvious that it was broccoli, for example. I couldn't figure out, it was something in this salad somewhere. And so it really is helpful to have a guide on the side to connect you and help you see what are some of the common triggers and what are some of the common soothers. So let's start with that. What are some of the common triggers for Crohn's? And then what are some of the common soothers for Crohn's in your experience? Knowing that, you know, my little phraseology is be good for you, like listen to your body. Obviously you have a nut allergy, don't eat nuts, for example. I mean, we're not going to be talking about that, but you dive into a little bit more about common triggers, common soothers.
Okay. And so, you know, again, like we said, there's no one size fits all. So, you know, it's not trying to, you know, push anybody's buttons here. But in general, that being said, there are some overarching themes. So for a lot of people, what I've seen is that gluten can be a really big trigger in terms of, you know, pain, bloating, just even brain fog, like, you know, that foggy feeling in your head where you kind of feel like you haven't really woken up. A lot of people find that that can be an issue. Dairy can be an issue in terms of producing mucus if you're having a lot of mucus in your stool or feeling just heavy, lethargic, things like that. That's a common one too. And probably even more than both of those is stress. Stress can kick the gut in like that. And then, you know, it's not pretty. And we've all been there. And then as far as soothers go, a lot of people love bone broth and soups just in general, like easy to digest soups. And for some people, actually, a vegan diet works really well too. So it just kind of depends. And managing stress, so meditation and other stress management techniques definitely help. And just mindset also. I feel like, you know, sometimes when you can shift your mindset and find even just one or two little things that are positive in your life, no matter how small, that can help. And that kind of creates like that positive domino effect, if you will. And your gut can then calm down, because when your mind is more calm, your gut is more calm. There's a connection there that winds up being really critical.
Yeah, that's so true. And I think people can, at some level, they can resonate with that. Like that makes sense. But it is helpful to just say, hey, from someone who's walked her talk and has got the results. I always say success leaves clues. And so worthwhile taking a look at. And then when people know what's causing it, what's soothing it, then they can make their choices appropriately as far as what they want. And you got me hooked on bone broth in September when you came out here to Kelowna from New Jersey, and even a vegan bone broth. So it's mushroom based, I think is me what it is. And it was, well, and you got me hooked on those mushrooms too as well. So it's very, very good. So awesome. So now I know that, and feel free to ask questions too, or if you that are watching here have observed the same thing. What's your experience with gluten? What's your experience with dairy? What's your experience maybe with bone broth or stress? In my opinion, you know, stress is at the root of all dis-ease, and it is kind of got veto power. So even if you're doing all the right things, if you're stressed, still not healthy. And it is something that a lot of us have to face or find ourselves facing, which brings me really to my next question. And this is really where you're going to want to grab a pen. So I know that as we're heading into the holiday season, it's a wonderful time of year, but it's also a very stressful time of year, where maybe stressful relationships, stressful schedule, maybe we're eating out a lot more, and maybe we're not responsible for the food, maybe we don't even know what we're eating. All of those things play into potential landmine when it comes to all of us, but especially if you have a delicate digestion, let's just say, or something that you're wanting to be mindful of. So I know that you've put together 10 top tips to help people navigate the holidays. So let's go through them and, get a list here. And at the end, I'll let you know how you can get a copy of this list. If you're not wanting to write all this down and you want to just pay attention to Dr. Selvi, that's fine. We'll be able to get you a copy of these. So let's write down, or let's go through these top 10 tips. So what are they?
Okay. So yeah, like Dr. Shaunna said, we all know that this is a very stressful time of year. So how can you help yourself get through the season, right? First of all, adequate sleep. I think sleep in general is just critical for healing, for tissue regeneration, just for all of those things, decompressing yourself from everything that's going on. And for people with chronic illness, it's even more critical. So to really make sure you're getting those 8 hours, like take a nap if you really need to. It's okay. Help your body just get through what it needs to get through. So that's a big one. And then the next.
And I agree. Like as a separate aside, when my dad had his stroke, a big part of that in the hospital, like they're really tired, and it's your body saying, "I need rest," and they're that whole parasympathetic rest and digest system. That's for real. So you want to find a way to do that. And in our fast-paced go, 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 especially at this season, it's easy to neglect that. And it's one of those easy to do, or maybe not, but easy not to do. And but you're hearing it here. It really makes a difference. And so absolutely. All right, number 2.
Okay, number 2 is learning to say no. So a lot of us, I think, just, feel like we have to meet certain obligations for whatever reason to make so-and-so happy, because we should, because, fill in the blank, really, right? So just sit with it for a minute and feel it, and just think to yourself, is this something I really want to do? Like, will this really make me happy? And if it will, absolutely, yes, do it. But if you have that sense of dread in the pit of your stomach, let yourself off the hook if you can, like as much as possible, and say no. And it's okay, say yes to yourself. When you're saying no to something you really don't want to do, you're saying yes to yourself. And that's amazing.
Yeah, I think it's really important. I think maybe especially women, but I think all of us, we get into this little people pleasing, and we say yes when we really don't, and it's so not healthy. And I know that you work with a lot of your clients to help them through that, because it is easy to fall into a default pattern and want to skip over that. And but it makes a difference. You mentioned before about mindset and calm mind. And, when we're saying no, or when we're saying yes, but we mean to say no, and we have that anxiety in us, you get that feeling in your gut. It's not good. And that does impact your cells at a cellular level. So absolutely. But it's easier said than done if you have a habit of a lifetime of that. So I know that's one of the things that you, in addition to all the nutrition bit, the other thing that you help support your clients through in helping them to be empowered within themselves. So, and finding ways to be able to say no and still be nice, but be able to say no. So excellent. All right, number 3.
And as a recovering people pleaser, like I totally get it. So
me too. Yeah, me too.
Okay, so number 3 is have a buddy as a way out. So kind of like a wingman. So you're going to an event of some sort, have a trusted person there where if you're not physically feeling so great, or mentally you're just not there, or you're exhausted or whatever it is, like just have some sort of signal, something really casual where you can tell this person and they know that you're not okay, and they can just get you out of there, and it doesn't have to create a scene. It doesn't have to be a big thing. And it will put you at ease. It will make you feel more calm, and chances are nothing's going to happen just because you have this out. But it's nice to have it there just in case.
Yeah, that's always good to have a wingman, or and know that that's okay. Like, know that you are preserving yourself, and because if you're sick and you're not productive, we've seen what it took a toll on you when it wasn't. So it's worth it. So it's helping you to say no. It's bolstering up that ability to say no if it's not cool. All right, the next one, number 4.
Okay, so sometimes eating before an event, like let's say you have something going on at work, or there's some sort of social event that you have to be at, and you have no control over the menu. You don't know what sort of food is being cooked. Like and you really can't bring something there. It's that kind of a situation. So eat something before that you know is safe. So you're not starving and just eating things because they're there, even though you know that they're trigger foods and you know you're going to pay for it later. Just do yourself a favor and, graze or, like look at something a little bit just to kind of be polite, but, eat before so you're not relying completely on that food.
Excellent. Excellent idea. And great for all of us, even if we don't have Crohn's. Like it's a great idea for all of us looking for either weight loss or just overall health. Excellent. Number 5.
Number 5. So let's say you're going to a family event or something like at a friend's place. A nice idea can be to bring a safe food. So sometimes, you don't want to necessarily feel like a burden or a pain, having them cook something to your needs and, putting 100 zillion specifications on it. And most of the time they're willing to do it, but you can bring something that ideally everyone can share. So now you're feeling like you're actually contributing to the meal. You're part of this family gathering, like in every sense of the word. And the people who are there can also partake of your food and see that you're not being deprived, that you're having food that's actually delicious. And so I love doing that personally. And I feel like that's another thing that can be very empowering as well, because now you have something safe to eat and you're showing other people a little bit about your life.
Yeah, I love that. Very good. Very good advice. And that what works for any type of intolerance, that food intolerance, you want to work with people. And, it really helps to minimize some of the drama that might come up around that. So being proactive, literally with your health, even in these little ways, has a huge difference. All right. Number 6.
Number 6 is taking 5 minutes a day to focus on the positives. So something really simple like a gratitude list. Let's say you're looking at 3 things per day that are going well for you, that you're happy about. And even if it's just, I woke up today and I don't feel so great, but I woke up today to fight another day. That's a win. That's awesome. So just that mindset.
Yeah. And, I'm a huge proponent of positive thinking. Obviously, anyone who knows me knows that's kind of my cornerstone. And, but it makes a huge difference. It's not just wishful thinking. And, well, check out my book if you're wanting to hear about any of that, but it makes a big difference and it helps in terms of stress relief and moving forward. It really does help to focus on that positive. And you're so right. It doesn't take much. And something as simple as like a gratitude list, what it does is it stops the negative train, even if everything else is going on, and it forces you to appreciate. And there's always something to appreciate. I know when we're getting in our own little pity party, we think that nobody has it worse than us, and nobody has ever suffered like us, and it's easy to think of all the things that are going wrong and think that there's nothing to be positive about. But something as simple I often use is like a glass of water, and just like, how many people don't get to enjoy this, like to be able to just enjoy water, like appreciate that. And really just focusing on those little things, the sun shining. Now, if it's not shining, now don't get it, but the sun shining, a favorite pair of socks, a cup of tea, like, your furry friend, and maybe that's a husband, I don't know, but no, or your 4-legged friend, it's focusing on something positive. It really makes a difference. And if you can do that, when do you recommend that 5 minutes? Do you recommend it beginning of the day, end of the day? What do you recommend, Selvi?
I like to do it beginning of the day, honestly, because it starts my day on a positive note. But if I haven't got to it at the beginning of the day, then I just reflect on the day and do it at the end, and I'm going to bed on a positive note. So you really can't lose, but given a choice in the morning.
Yeah, and I think especially when people are super busy and they're like, I don't have time for that. And part of me is like, you don't have time not to, because everything will go your way a lot better. But even just, taking a moment and linking it up to a daily habit that you're doing anyways, whether it's brushing your teeth or showering or blow drying your hair or something like that. And it's like, I'm going to take these 5 minutes and I'm thinking positively, or going for a walk or those sort of things. All right. Number 7.
Number 7, take your medications. In the midst of all of the busy schedules and the travel and, things just getting disrupted, it's easy to forget to take your medications, especially if you're on something that's on a daily basis, or even with travel, sometimes IV medications can get disrupted. So just plan for that. And to the best of your ability, keep your medication regimen regular. It's really important, especially with all the added stress and all of the changes that are going on, to keep all of that as regular as possible.
Yeah, I think that's really a good, with the routine. When you disrupt your routine, it's not uncommon that, I have relatives who, as they're traveling, and they're usually link it to, I don't know, breakfast or something like that when they take it, and then it's disrupted in a different place. It's easy to forget. So that's really important too, because this is a time when people's routines generally are disrupted. We're heading into that season just now. All right, number 8.
Number 8 is treat yourself. Do something small, just something fun for yourself. There's a lot going on and it's really easy to forget about yourself. So, maybe it's just like a bubble bath or a coloring book, or, playing with your pet, maybe taking a walk in nature, lighting those candles that you've been saving for someday, whatever it is, something that's just small and easy, that you can do for yourself. I'm not saying go and eat the pepperoni pizza. No, 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 please no, because that was my thing. That's not what I mean. But do something that will feed your soul, and yeah, will make you feel good at a deep level.
So this is really good. And I want, as an aside, type in and just know that Facebook shows your comments, and then it's like, I've got 2 screens going. So if I'm looking over all around here, and then it doesn't show your comments. So it's only showing 4. And I know that it says there's 8, but it's only showing me 4. So if you're asking questions and I'm not getting around to them, then we will at the end, or we'll let you know how you can talk to Dr. Selvi herself so you can get them. But type in the comments, and I will try and look as soon as I can, and catch them when you're saying them. But of those things to treat yourself, think of what is a way that you can treat yourself this season. What is something small, like Selvi mentioned, like coloring or playing with your pet, or walking in nature, or lighting a candle, or a bubble bath, or something like that. Let's share some ideas over here. Is what is like one of those pampering little things, something positive and nice, being kind to yourself. What is something that you can do? And if you got another idea, feel free to pop that in there. In the meantime, before we get to number 9 and 10, our last 2, you said something about not a pepperoni pizza. Yes. I remember one of our conversations that we had, and I think this is where people get tripped up and they sabotage themselves unknowingly. And do you remember that conversation? Like when you were young and you have Crohn's? Describe the scenario if you can, and because I thought it was pretty funny, but it's also like true. And I think a lot of people are inadvertently making it worse for themselves without realizing it.
So this was back when I was living at home, and I was in this phase where I was pretty much constantly in pain. Nothing seemed to help. I didn't know what to eat. I didn't know what to do. And I'd always loved pizza. And so, I was just like, I want something that's going to make me feel better for 5 minutes. I want pepperoni pizza. And my mom was more than happy to go and buy me the pepperoni pizza. So I would proceed to relish every bite of that pizza. And sure enough, 15, 20 minutes, 30 minutes later, I'm screaming in pain, like, holding back curse words, screaming in pain, bloated like a pregnant woman, like horrible. And it was just like, I think like we talked about, right? Like that 5-minute mouth orgasm leads to this food baby that just will not go away, will not relent. So not worth it. But at the time I was just trying to numb out from the pain, numb out from my reality. And that was my escape, but it was not a healthy way of doing it. And so that's why I try and recommend, things that actually will feed your soul and will, affect you in a positive way, as opposed to making you more sick and, more pain and winding up on the porcelain throne. And, we know how that cascade goes.
Yeah. And I think it's really important to share that, because like Sylvie's really been in this. She knows, she's been there. And you know, when you're sick, you kind of feel sorry for yourself a little bit. Oh, I don't want it, and I don't want this, and then just like, you know, and someone, and then the people that love you, they don't want to see you like that, so they want to help make it better. So they want to cater to you. So they're like, what do you want? I'll give you anything you want. And I want a pepperoni pizza. And so they're loving, out of love, they're wanting to make you happy. But yeah, the food baby from the mouth orgasm, I love that. So it's not worth it. It's not worth it. You know, it might not last like 9 months, but it's not worth it.
No.
And so it, but not always, because usually when you're feeling sick, then you do that, and then you're still feeling sick, only worse, and you're going worse and worse and worse in that direction. But you don't always realize that you had a hand in it, or that you could do anything about it. And that's why I think this episode here that we're doing, that's the message that I really want to get out. Like, here's someone who's been in remission for 9 years. So there are things that you can do, like this really works. And I always remember when I was starting on my healthy journey, I was kind of like, well, why should I? Like, I'll have this kale and this broccoli, but like, why should I? And once I really educated myself on superfoods and what they do, I'm like, oh, you know, decreased risk of cancer, heart disease, diabetes, you know, all of these things. I was like, and like actual science, look it up, PubMed, look up different things. It was like, wow, well, why would I not? And now you can make a choice. You want to feel like this, you do this. You want to feel like that, you do that. And it's really decoding that, what works for you. And I know that's what you help do with your clients, because it's, you've given some general guidelines, but there is that bio-individuality. So everybody's like a little bit different, and it's about figuring out what are the common triggers, and then what are the confounding factors about stress and anxiety. And so maybe it wasn't something that you ate, maybe it was one of these other things. And I know in just this short time we have together, we can only go so deep. All right, number 9.
And this kind of also, just quickly, I just want to say that you are the expert in your own body. And this kind of goes to number 9. So know your safe food and avoid your triggers. And, you know that better than anyone else. So especially during the holiday season, focus more on those safe foods, that you know are going to work for you. And the trigger foods that you know you're going to pay for, try and avoid them as much as possible. That being said, also, of course, it is the time to indulge. So, you have like Aunt Patty's sweet potato casserole, and you know that sweet potatoes generally work for you, and you can have a few spoonfuls and be okay. Go for it. Let yourself off the hook, right? This is the holiday season. But if you know that sweet potatoes really don't work for you and you're going to wind up in the bathroom, probably best to pass on that and maybe go with something that'll work a little bit better for you.
Yeah. Excellent. Yeah. Excellent. And all right. Well said. Tip number 10, our final tip here.
Final tip, enjoy yourself. This is the holiday season, right? This is about friends and family and love and gratitude and all of those things. So, as much as possible, thank yourself just for showing up, for being where you need to be, and, being who you need to be. Support yourself as much as possible, and just cherish the memories, cherish these moments. And yeah, that's what it's about.
Excellent. Excellent. And I'm looking at, people have some great examples for pampering themselves, daily walks and hikes and morning hot tubs and taking a weekend getaway road trip and body massage. And those are the ones that it's allowing me to see. I know somebody quickly had a question about things that you can do to manage stress beyond meditation. You and I are both proponents of meditation for sure. And any other things that we recommend for stress relief. And then if I missed it, I don't see that question now, but if we need to, we can come back to that after. Anything, what do you do for stress relief, or what do you recommend?
I do love meditation, but it doesn't necessarily have to be just meditation. For some people, that's even just being out in nature, just connecting, being in that space, whether it's going for a walk outside, maybe going for a hike, something like that, just anything where you can just kind of focus on yourself. You know, it's actually a good one for me. And this might sound a little out there, cooking. When I cook, I get into my Zen state. I am connected and I am just in my happy place. So whatever that is for you, for some people it's painting, for some people it's, you know, something that's related to art or music or dance or, you know, whatever it is where you just kind of lose yourself for a little while in something that you adore. It could be gardening. You know, there's a lot of ways to get in that sort of state.
Excellent, excellent. And another off the wall question. There was something about supplements or something, and so I know that you have a series of things that you recommend for people and kind of phase it in depending on where they're at and what's happening. Anything that you want to share on that, but just bearing in mind bioindividuality, it depends where you're at and all those things. Is there any like foods or spices or something that you're like, this is really good for decreasing inflammation, or anything that you want to share in that regard?
Sure. Well, you know, being from India, I love turmeric. It's great as an anti-inflammatory in general for people who have, in particular, joint pain. Like, you know, a lot of people with IBD have the extraintestinal manifestations, excuse me. And so if you have a lot of joint pain, that can be something that's really effective at treating the inflammation and preventing further inflammation from coming back. A key is that if you're using it in your cooking, you want to make sure that you're adding a little bit of black pepper to it to increase the absorption. And if you're taking supplements, again, look for added black pepper in the supplementation. And of course, probiotics. And there's something that's called L-glutamine, and that's really key to building up the gut lining. So, you know, again, the amounts and all of that is individual as well. The types of probiotics that I recommend can be very individual as well. The counts and the strains and all of that, there's a lot that goes into that, but certainly those things are critical.
Yeah, excellent, excellent. And because there was something about a question about that. I know we weren't going to go deep into those things, but and then I can't access that. Don't you love Facebook? We have to play by their rules. I don't really. So I want to do a couple of things. And maybe I can ask my awesome husband if he can post a link to, you have a free Facebook group that you have for people if they're wanting to know more. I believe it's Dr. Selvi's Cooking with Crohn's. Is that it?
That's correct.
And so you're welcome to ask to join that group. I know that you are a great cook, and so you have that Cooking with Crohn's, and that's where the turmeric and the black pepper and the bone broth and all those good things come in. So you're welcome to do that. In addition, we had talked about, well, some of you may have more questions, or you may want to reach out. And I know that you opened up your calendar for people. I'm going to see actually if I can, oh, there you go. Oh, look at my husband already posted your link.
Nice.
Dr. Selvi's Cooking with Crohn's. There we go. And then the next link that I want to share is just, I know you opened up a few spots just for us, and I'm so thankful for that. I really appreciate that. And so Dr. Selvi is willing to have a call with you. So if my husband is able to post that link to your calendar, that would be fantastic. So book a time that works for you. You can do a little deep dive. She'll ask questions, and you can tell her your specific scenarios, because this is great general information, but no doubt you have some specific questions, and she can dive into a little bit about your specific scenario. Is it Crohn's? Is it colitis? Is it whatever? And then your website, what's your website, Selvi?
My website is www.drselvi.com. So it's drselvi.com.
Excellent. So feel free to check it out there. And if they want the top 10 tips that we just went through, I think you'll probably post it in that Facebook group. So that's one way. But how else can they get that from you?
You can certainly email me as well, or if you have any other personal questions about your situation, my email is selvi@drselvi.com. So that's selvi@drselvi.com.
Excellent. Excellent. And I don't know if I'm going to I'm going to post that one there, I think. So I've got that, your email there. So if they're emailing you, just say what, top tips, please, or something like that. Awesome. Excellent. So I just want to thank you, Selvi, from the bottom of my heart for doing the work that you do. You are such a beautiful soul and just being, and a lot of fun. And she has like an incredible sense of humor like you've never seen. You can kind of get it from the food baby comment. You get a little glimpse into that, but she is a lot of fun and super sweet, but super smart as well and knowledgeable. And so if you have Crohn's and you are suffering and you're looking at how can I soothe these flares, or how can I prevent them, or what is it that I can do? You know, is there anything I can do to help that? Then absolutely, you know, click that link, book a time with her. Or if you're seeing this and you don't see links, just go to drselvi.com, drselvi.com, and she will connect you. So with that, I want to thank everyone for joining us at this Health Coach TV. We're going to be talking next week with, I believe, Stacy Reed with irritable bowel. So if that's your realm too, we will go there. I believe that's who's up next. I just want to wish everyone a great night, and most of all, be good for you.